As we mentioned earlier in the show, the Ontario government has tapped Jane Philpott to head a new primary health care team in the province. Philpott, a former federal cabinet minister and the dean of Queen's University Health Sciences, will take on the new role in December. We'll see her lead a team tasked with connecting every person in Ontario with primary health care within the next 5 years. The province says the goal is to improve on the number of people with access to health care providers. Currently, about 10% of people in Ontario do not have such access. And joining me now is Dr. Jane Philpott, chair of Ontario's new Primary Care Action Team. Doctor, thank you very much for joining us today. Congratulations, but a big task ahead of you.
Thank you. Yes, it is a big task, but it's an important one, and I'm happy to take it on.
How are you going to approach this?
Well, I have a vision that I share with many of my colleagues across the province and maybe even across the country, that we believe that every single person in this province, in this country, should be attached to a family doctor or a primary care nurse practitioner who works in a publicly funded team, and that there will be health homes or health teams in every neighborhood. And so we are going to need to add some additional resources to the teams that already exist, and we're going to need to add some new primary care teams in Ontario, and we will keep going until every single person has access to care close to home.
Now, many provinces, though, are in a similar situation. How do we add new personnel? Where do we get them from?
Well, we are constantly training new family doctors, nurses, nurse practitioners, etc. Oftentimes, they don't want to work in the current kinds of models of care that we have. They have an enormous administrative burden on them, and family doctors are stretched to the limit. We need to make sure that we create teams and create the conditions of work that new medical students will want to become family doctors, and those who are trained in family medicine will want to work in family practice and stay in family practice. So we will be making sure that we develop these teams in a way that are attractive to providers, as well as meeting, of course, the needs of the patients.
Now, you mentioned health homes. What exactly is that?
Well, we like to use the term health homes. It's really a patient-centered medical home. It's a place where family doctors work alongside a cadre of other health professionals, nurses, nurse practitioners, pharmacists, dietitians, social workers. And when we do that, we can actually stretch the capacity of teams so that even though you might have a family doctor to whom you're attached that you will ordinarily go to for your care, and you'll develop a relationship with them over time, but on any particular given day, that family doctor might not be available, and it may be that the nurse on the team or the dietitian on the team could give you the advice that you need, and that way we can be able to make sure that we can provide care in a timely way for every single person in the province.
Now, from a political point of view, a Conservative premier asked a former federal Liberal minister to help out with this. Were you surprised, and do you think you can actually work with the government there?
If anyone wants to fix healthcare in their jurisdiction, I'm happy to help. I don't think healthcare should be a partisan issue. I'm happy to work with people of any political stripe that want to be able to do this. I have, since my book called Health for All came out in the spring, I have responded to requests from probably 4 different political parties who have asked for advice on this, and I've been happy to provide it. I'm really honored that Doug Ford has asked me to be able to do this work in Ontario. And Canadians don't actually care which political party fixes their healthcare system. They just want the healthcare system fixed.
Are you optimistic that anything you recommend will be implemented?
I am optimistic. I wouldn't have taken the job if I didn't believe that the government was serious about this. I've been very blunt in terms of telling them the additional resources that are going to be required. I believe that they are motivated to be able to provide this care, and I certainly will be working very hard with a team to be able to make sure that we can deliver on better access to care for people in Ontario.
Now, you start this job, the new position, December 1st. When can we hope to see some kind of change in Ontario?
Well, my plan is to spend the first 100 days mapping out a very detailed list of expectations and timelines to be able to understand exactly how big the problem is, and then when Ontarians can expect to start to see more care in their communities. And so I hope that there will be lots to report on very early on, and that we will be able to provide progress reports along the way.
Okay, we look forward to an update. Congratulations, Dr. Philpott, and good luck with it.
Thanks, I appreciate that.
Dr. Jane Philpott is the chair of Ontario's new Primary Care Action Team.